Welcome back, folks. We continue to talk about quality and affordable childcare. We have an expert joining us remotely. She is Winifred Smith-Jenkins, Senior Director, Zadie's Nurturing Den. Good to see you, Winifred.
Thank you so much for having me on today, Steve.
Describe the organization. You have 3 different locations, right?
We do. So Zadie's Nurturing Den is located in Summit, New Jersey. It cares for children 0 to 6 years old. We have 2 locations in East Orange, Zadie's Early Childhood Center and Zadie's of the Oranges. Zadie's Early Childhood Center is a private childcare center, cares for children 0 to 5, and Zadie's of the Oranges is a public, has a public partnership with East Orange Board of Education in South Orange and Maplewood, and it cares for children 3 to 5 years old.
So, Winifred, let me try this. I mean, we're doing this programming, all of it, trying to look at the longer term implications of COVID-19. We're taping in the middle of May. It'll be seen after that. For day-to-day updates, you can check NJTV News, Metro Focus, other news sources. But I keep thinking, what will the child care centers of the future look like? Say we're talking about the fall of 2020, beyond that. Do they have to be reconfigured? What has to happen for our children to be safe before we can even move forward?
Those are great questions. And the hard piece I think that we're struggling with is getting the right guidance, from the state of New Jersey, from the Department of Health and Human Services, like where are we supposed to get this information from? There are some things that are coming out. Some centers are currently open and they're open for essential personnel only. So we're starting to gather some information from there. I mean, I think that all centers are going to have a no visitor policy. They're going to have to limit access to the facility, even for parents, right? They're going to have to be some level of infrastructure repairs and updates. You're going to need upgrades. You're going to need protective barriers. You're going to probably need some HVAC upgrades, maybe additional hand washing sinks. Getting staff to come back to work is probably going to be instrumental in this whole thing, right? And it's going to be really important. But you also not only need to get your old staff to come back, you're going to need to train and retain and hire new staff to come in. They're going to be smaller classroom sizes, and this is, of course, going to affect the bottom line. You're going to need additional professional development. We will be on the front lines working throughout this kind of COVID environment, right? We're going to need to be able to source and purchase additional cleaning materials. We're going to need mental health services because we need to make sure that we're keeping ourselves and our babies that we're holding safe. And our bottom line just isn't ready for all of this.
You keep mentioning the bottom line. And when I started this segment, I talked about quality and affordable childcare. The economics of childcare, particularly for the children who are most vulnerable. We're doing a series called Right from the Start NJ. The folks at PNC are focused on growing up great, or grow up great, if you will. But particularly for our most vulnerable children. First, how will the economics change? And B, what will the implications be for those who are our most vulnerable children?
So, childcare is one of those things that you can only charge what the market can bear, right? And with these new changes that have to happen, unless there is an influx of money from the federal and state government, then you're going to see a lot of childcare closures. We already have a significant number of childcare deserts in New Jersey. I can see that number increasing because we will not be able to handle the economics of all the things we'll need to put in place to be able to offer high quality childcare.
What are the implications if more childcare centers close because of the economics? I mean, quality childcare centers. What are the potential implications longer term for those children, their futures, and their families?
So we're the workforce behind the workforce, right? In order for parents to go to work,
that's right.
They need childcare, right? So the future, you're going to probably have a lot more parents, whether they're moms or dads, coming out of the job market because they won't be able to find affordable, high quality childcare. You'll have maybe unlicensed centers that are opening to try to help parents. And unfortunately, once a center is unlicensed, then we know that there are some things that can happen that could put children in jeopardy.
Right.
I think you'll also see an increase in the access and equality, right? Like there will be a huge divide between the haves and the have-nots.
You mean worse than what it is already?
Yes, yes, 1,000 times worse than what it is already.
Anyone who's following the COVID-19 crisis, the global pandemic, excuse me, the fact that a disproportionate, totally unacceptable number of folks who are Black and brown are being adversely affected, getting sick, and dying from COVID-19. Is that mirrored, if you will, when it comes to childcare, in terms of it's already a problem? There are already social determinants of health. There are already a whole range of issues that adversely affect those who are in minority communities and struggling and economically, et cetera. What happens to these children? Do you sense that we understand what the long-term implications are for these children and for all of us, society?
I think this is new. I don't think that we have all the answers, but I think that we can come up with some pretty good answers, like universal childcare, right? So that we can ensure that no one falls through the cracks.
That's right.
This wasn't anyone's fault. So we need to make sure that we do our part to make sure our babies are safe and they're prepared for kindergarten.
Because that's not just for them and their families, that's for all of us.
That's for all of us. That's
right. Explain, 30 seconds, explain why them growing up great, those kids growing up great or the best they can be matters to all of us, whether they're our kids or not.
So we know that children who go to high quality childcare centers would generally tend to continue and graduate from high school, right? We know that they will be prepared for some of the social challenges that they may face when they get into elementary school. But we also know that it doesn't start at elementary school. It starts when you're holding a baby, an infant, a 6-week-old, right? So if we don't put in the work now, we're going to pay for it either on the front end or the back end, as my mom likes to say, but we will pay for it. Society will pay.
Well, Winifred, we thank you for being with us. We look forward to continuing the conversation with you in the future. These are all of our children, and it not only takes a village, it takes a lot more than a village. We thank you, and we wish you all the best. Stay safe and be well.
Thank you. Same to you, sir.
I'm Steve Adubato. We thank you so much for joining us, and make sure you stay safe and be well as well. We'll see you next time.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by PNC, Grow Up Great, the Turl Fund, supporting Right from the Start NJ, Atlantic Health System, New Jersey Sharing Network, the North Ward Center, the Healthcare Foundation of New Jersey, the Fidelco Group, Guarini Institute for Government and Leadership at St. Peter's University, and by Choose New Jersey. Promotional support provided by the New Jersey Business and Industry Association, and by New Jersey Monthly. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.